I'm Dr. Rosie Roeder, and I'm with my co-host,
Andrea Spar.
And we are the Rejuvaness Podcast. Today, we're going to be talking about melasma.
Yeah, it's a super, super common condition, but I think a lot of people kind of misunderstand what it actually is.
So what is melasma?
So melasma is a blue, brownish, gray pattern that you can get on your face. You can get it at any time in your life. It's majority of seen in women, but men can get it too. Usually appears on the face, forehead, cheeks, around the lips. They call it mask of pregnancy, but again, It's not just due to pregnancy, but it's basically an overproduction of the melanin that's in our skin. And that's really hard to kind of calm down for a lot of people without seeing a dermatologist.
I know I have a lot of patients that come to me with their brown spots.
Mm-hmm.
They're there to have facial consults for other reasons, right? Fillers, Botox, sometimes facelifts. And you guys have heard my bad analogy. And especially for women, I guess 90% of this occurs in women, is that correct?
90% of it occurs in women. But again, men can get it too.
Men can get it too. So that's important to know.
Yep.
Don't be shy. If you have a brown spot out there,
me.
come and see us. Yeah, please see Andrea before you see me, because she has the tools for it. But it is a common thing that I see as well, that I do refer to my dermatology partners, because I think you guys are much more equipped to deal with it. And there are medical treatments and...
Yeah, and I think it's important to know that there's different causes for it.
Right.
Most people just think it's just the sun, but it's not just the sun. Sun is a major part of it. It causes a majority of it, but pregnancy, hormones, birth controls can also affect it. And a lot of my patients, even though they're like, I haven't been out in the sun, the internal heat that's here in the South, just heat in general can cause melasma to worsen.
I tell my patients that we live in planet Earth. Even if it's not sunny outside,
yes,
you're going to get sun rays coming through, right? So I think it's a little bit of a misconception that you have to just be the person on the beach with the reflector. Yes. And
I get a lot of, I never go outside.
Right.
Well, how did you get here?
Right. So you're affected by the sun no matter what we do and how much cautious you are. So causes, I think you briefly said, sun exposure, hormones, other different life events, medications
can definitely cause it, like birth control, even just inflammation in the skin. So if somebody has like an autoimmune disorder, the inflammation from that can cause your melasma to worsen.
So I would imagine that your triggers are going to be different, right, for this kind of disease, depending on the person.
And there's no cure for it. So it's all about the maintenance. I tell everybody, for these specific problems that you have, there's no cure. If we can get you in a good maintenance regimen, a good skincare routine, wearing your sunscreen, using proper topicals, we can try and get it under control and maintain it at a good stable rate.
So talk to me about the different types of treatment, because I would imagine there's some skincare products here. I imagine there's some non-surgical tools like lasers, for example, right?
Lasers you got to be careful with, though. That's what I always tell people. The heat from the laser can actually make your melasma worse in some areas. So you got to make sure you're seeing somebody that knows exactly what they're doing and how to handle melasma. Chemical peels I like a little bit better than the lasers, but again, you can get lasers as long as you're going to somebody you know what you're doing. There are over-the-counter products that you can start with. There's the Eucerin that has a new dark spot lightening. La Roche-Posay has a dark spot lightening, but that can help kind of accelerate the skin turnover to kind of shed those cycles. And I tell everybody, it's going to come back. You've got to be able to use these products in consistency to see that change. By the time people usually get to me, they thought that they've been through everything, and then I'm like, oh no, there's 47 other products that we can try. But prescription wise, there are good products on the market. One of them is hydroquinone. Have you heard about that?
Yes.
Yes. So that is a brightening lightening cream that you can use. You don't use it year round. You kind of take little breaks from it, but that can actually help take some of the melanin out of those pigments in the skin.
You're going to be able to find some hydroquinone that are non-medical grade, so they're a little bit less of a percentage over the counter. But the things that you can get under prescription or at a dermatologist's office will have a higher percentage of it. And I do hear a lot of, I've used this and now it's back, right? And I think you kind of mentioned the tolerance you can get, which is why you don't tell your patients to use it year round.
Yep. I usually have them rotate that with some type of retinoic acid or retinol. But now there's companies on the market that are doing wonderful compounding creams that have those compounded together. They also have other products like azelaic acid, kojic acid. Those, again, help accelerate that skin turnover and help with that extra pigmentation that you're getting. And even TXA or tranexamic acid, which can come in topical or pill form.
I love TXA for so many reasons on my surgical realm, and I think it's really underutilized on facial treatment, especially for melasma. I see that it is highly successful in studies, and I don't prescribe it as much because, again, I try to leave this on the realm of the dermatologist. I use it in other ways, but I really love that you mentioned it. I think it's one thing that people don't really go to as even a second line, and maybe we should be doing a little bit more of that.
And some of the oral versions in general, they've been known to help with some of the stubbornness melasma that's out there, but I tend to stick with topicals as long as we can maintain with topicals. I never want to add another pill to somebody's routine. Plus, some of the oral medications have more side effects that can be associated with them, so they require more lab monitoring and watching the patient.
What are certain things that patients should avoid if they have melasma?
Definitely hanging out in the sun too long, being in a hot car. If they're just like watching their kid playing soccer and they were like sitting in the shade, if it's 90 degrees outside, you're still going to have your melasma changing just due to the heat. So make sure you have a little neck fan. They have so many neck fans on Amazon nowadays. Making sure you're wearing your sunscreen, making sure you're using those products, even cool compresses. If you're just hanging out at the beach all day, get some ice out of the cooler and throw it on your face for a little bit. Those little things can help kind of keep the inflammation down in the skin.
So infrared lights are really the rave now. Do you think this affects melasma? Because they're supposed to be anti-inflammatory for so many other benefits to the skin.
So looking at some of the studies in general, I think it depends on the frequency and the actual depth that the red light can get in. They have laser light masks now too that can tend to help, but some of them can get overheated if you're just buying a $40 one off Amazon. So it's all about the quality of the product. If it's got the true anti-inflammatory properties in it and it's getting deep enough in the skin, it definitely can help stabilize it.
So I guess the key there is just to make sure that you talk to somebody before you get one of these red light masks, that it's going to have the right heat and depth. And a lot of these are not necessarily regulated, so you may not know. You're going to have to trust the manufacturer, right? There are some red lights that are available to dermatologists that are a little bit more stringent in how they deal with that. And some of the, we'll call it laser technology just for simplicity's sake, but the IPLs, BBLs are a different spectrum. They might have things that are more suited if they're in the dermatology office to deal with some of the inflammatory conditions of the skin.
Instead of just getting a Groupon, going to Joe Smo on the side that says they definitely can do laser on your face. Those are the ones you don't trust, okay?
Yeah.
Because you got to make sure somebody's taking care of your skin, because you're spending the money for somebody to take care of your skin.
Yes, especially if you do, I think especially if you do have a complicated problem as melasma. I'm going to say it's complicated because I think it's a lifelong.
Yes, and a lot of these DIYs over the counter from TikTok and stuff, it's making people's skin worse. And by the time they get to me, we have a lot of work to do.
Yeah, that's really sad though. I think there's so much of medicine that's going on the wayside.
Yes.
Of people just listening to influencers, but they don't have the scientific knowledge and the backup to do it, but they're really good at selling themselves and marketing. So again, we just caution you guys, like we try to speak in generic terms and have a lot of evidence based to what we say. So just be careful out there. If something seems too good to be true, it tends to be.
It usually is. If they're showing you results overnight from melasma, I would be scared, because it's just all about the management. Like we said, it's consistency, patience, and wearing your skin protection.
Let's talk about the difference between a sunspot and melasma.
Okay.
Because some people can have large sunspots. And we talk about hyperpigmentation in different areas of the body. And then we talk about melasma versus solar elastosis, which is just a fancy name for, your aging skin, right?
Wisdom and maturity spots.
Wisdom and maturity spots, sunspots.
Yes.
And freckles. And sometimes they all get lumped together.
And then a lot of them you've had most of your whole life. A lot of them go along with genetics. A lot of them come with age and UV exposure. So it takes a dermatologist to be able to look at them specifically and give you the correct diagnosis.
I'm going to ask a question just because I do some basic skin checks, mostly related to skin cancer, but not a lot of full body skin checks. Tell me how you would like a patient to come to your office to see you for a regular skin check. Like, you know, I see all these women coming like dolled up with all their makeup on, and they have very difficult and beautiful like clothes that they've worn all day at work. So like if you were telling somebody to come to get checked out for their full body skin check or their face for you to diagnose them with a problem like melasma versus other skin conditions, like ideally, what would you tell your patient?
You know, you don't have to dress up to come see your dermatologist. We have seen it all. We usually even ask you to get undressed and put on this gown so we can check everything to make sure there's not any areas of concern, because a lot of people live alone. They can't see their back. They've never had a skin check, but a lot of women do come in mid-work, after work, and they come in with a full face of makeup. I try and keep gentle cleansing cloths by Cetaphil in my office so these women can wipe their faces off so I can get a good look at areas, especially if they have areas of concern. A lot of people come in and they're like, I have a mark on my nail, but they have gel polish on and I have no way of getting that off. So that's making them have to get another appointment to go get their polish off so I can actually get a good look at these areas. So you don't have to impress us. We are there to look at the raw skin, just like we're giving you the raw truth. But you don't have to look like a homeless person either. You know, I'm not telling you just to crawl out of bed and roll up. If you need to come through in work hours and you have makeup on and you're dressed to the nines, that is okay. But I will probably make you remove a little bit of makeup so I can see your skin. Yeah, so bring your makeup bag. If it's important for you to go back to work and redo that. I think that's a great tip because we don't think about these things, especially the nails, right? Even for me, who's not a like board certified dermatologist, but again, I see a lot of skin cancer patients and they'll come to me after an excision and be like, hey doc, can you look at this, right? So I'll take a look at it. I routinely look at nails for many different reasons, right? Just a healthy nail bed for fungal just screening, psoriasis, right? For psoriasis, eczema, and we can have just a streak. I got a lot of referrals for nail biopsies for what is probably just a normal, so you can get freckles in your nail bed, right? Melanchia, exactly. So it's important to be able to take a look at it, and sometimes you can get skin cancers at the nail bed as well. So being able to see nails is critically important. It is very important. And I always try to get them to take their socks off too. I usually pull their socks off and I give them the story of, you know, Bob Marley had melanoma between his toe. I just like to check between your toes, but I put their socks back on. I've learned if you didn't like feet, you never go into dermatology. I was always told that. So I'm comfortable with removing your socks if you want to keep them on for the time being. But yeah, I definitely like to look between people's toes, their feet. People don't get down there enough to look at their feet. Some of them never even knew they had a mole on the bottom of their foot when I pointed out. And I know one of our focuses was melasma today, but I wanted to talk to you about white spots. So I see that a lot as well, right? Yes. People who have areas that never tan. Idiopathic guttate hypomelanosis. Fancy term for white freckles. Right. So how concerned about those are you? You don't necessarily have to be concerned about them. You get dark freckles from the sun. You get light freckles from the sun. Those areas of skin are just damaged from so many years of UV exposure that there's no melanin producing in those areas. So I tell my patients, if you really want to cover them up, you're going to have to put a self-tanner on top of them because they will never tan because there's no melanin to tan in those parts. But very common. See it on shins, arms, especially my women. I have pityria rosacea. So that's another thing that's kind of makes a mark on our skin that sometimes people might be a little eerie about. I see it on some Facebook posts at times. Oh my God, like there's this like area that's totally different than the rest of my skin. And some people are like worried about vitiligo, right? So there's lots of different characteristics of skin. So there's a spectrum, right? There is a spectrum. So talk to me a little bit. I know we probably weren't going to talk about this, but I'm going to take it there. Talk to me a little bit about vitiligo and some of the options and how you diagnose that as opposed to like dark spots. So vitiligo is kind of where your body starts attacking in the melanin in the skin for some reason. Could be an autoimmune disorder, could be genetics, could be sun exposure, could be a slew of things. But it starts attacking the melanin in the skin due to the inflammation, and those patches can get larger. I see it anywhere on the body: face, buttock, groin, feet, even our private parts. Okay. So in general, people come in, you kind of take a look at them. There's two different types. You have one-sided vitiligo, you have two-sided vitiligo. So it's called segmental and non-segmental vitiligo. But definitely can be anywhere on the body. Once I diagnose somebody with this, we look at more anti-inflammatory properties of medications like topical corticosteroids. So I usually have them do a trial of that for 2 weeks on, 2 weeks off, 2 weeks on, 2 weeks off. I also add in something called a topical calcineurin inhibitor, which would be like tacrolimus, that takes the inflammation down in the skin to try and get some of that color back. And they use that on their 2 weeks off of their steroids. So I always have something constantly going on the skin, including their sunscreen, because again, we don't want to cause any more damage in those areas because that skin's more apt to burn because it has no protection from the melanin. And usually it can cause enough inflammation to calm down to allow some of the pigment to come back. Now, vitiligo has no cure as well. It is a lifelong thing. Usually when you stop some of the medications, it's going to tend to come back, and sometimes it can come back worse. I have a patient that I inherited from somebody that had retired, and she's been working with her for years, and she finally rebounded, and none of the medicines were working anymore. So we have her on a new medication on the market called Opsilura, and that is a non-steroid that can go on every single day. But it takes about a year to see full change in the skin.
That's really interesting that it takes a whole year.
Yep. Most of those patients can get about 80% of their color back with a year of just Opsilura.
Do you do extract?
So I don't personally do extract. I usually refer to one of my other colleagues. I usually do light box for eczema, so we all have our little niche. But I do refer extract for smaller areas, especially around the neck, face, scalp, stuff like that.
I've never even seen it, but I know a lot of people doing it. So I was like, oh, maybe I'll ask Andy a little bit about it. What are kind of myths around these pigmented lesions on the skin that you would like people to know?
Just because it's been there your whole life doesn't mean it's not something, because moles can always change. So I'm like, you can have something changing now from 30 years ago. Okay. I had a brand new mole removed a month ago that popped up 3 months ago, and it was abnormal. And I guarantee it's from my days in the tanning bed back from when I was a teen. So just because you have new moles does not mean there's something on the other end of the spectrum. Okay. New moles, new raised rough places could be an age spot, but anything new over 30, I usually recommend getting checked out by somebody that can look at it a little more in depth to make sure it is not something.
Is melasma something that is age related?
No, it has no age appropriated with it, because again, it could be hormonal. So I've seen it as early as teens. I've seen it as old as senior age. It definitely just depends on, like I said, your hormones, your UV exposure, oral birth control, if you're going to get it or not.
So if you have something that looks like melasma, somebody has told you it's melasma, but it's changing, it's time to go back.
It's time to go back. It's time to get it looked at, because it may be something else on top of that. You can get those age spots that we were talking about earlier on your face. They're called solar lentigos or solar lentigines, and people get a lot of those sun freckles. They tend to come up in more circular leaf-like patterns on the face compared to patches, where you're getting those blue-gray patches from melasma, and you can actually get an early melanoma in those called a lentigo maligna. So I usually tell people, even if you have those on your face, getting that yearly skin check so we can kind of look at it with our dermatoscope to make sure nothing internal is changing, or they call it colors and chaos. You're looking for structures and colors in these moles to see if they're changing, to make sure it doesn't need a biopsy.
All right. I think people get scared of the word biopsy.
They do get scared of the word biopsy, but it's not that bad. I want to reiterate to people that we're not coming in here to cut you off from the neck down for a biopsy. It's usually a small area, depending on the size of the lesion to begin with. Sometimes we take a little plug of skin if we need to see what's going more on underneath in the depth, but they're all tiny areas. It's nothing like worse than you scraping your knee.
How long does it take you to do a skin biopsy?
Less than a minute.
Yeah, I tell my patients like 30 seconds.
It's
it really is.
From the time we numb you, do it, clean it up, put a Band-Aid on it, less than a minute.
Yeah, absolutely. So it's a quick thing that you can do to make sure that you're safe and to get a very accurate diagnosis, because I think that's important. People might look at your skin and tell you this is what this is, but sometimes having that pathology to confirm it is really important, or to rule out badness.
Yes, because I think a lot of people refer to Dr. Google for things too. So Dr. Google will tell you it's one thing, and it can be completely on the other end of the spectrum.
Yeah, very important to just...
I see a lot of people get worried about the cherry angiomas, the little red vascular lesions, because they start... I tell people, you get one, you get 100 of those. Our parents give us everything but generational wealth. They gave us all the skin issues. So you get those age spots, you get those cherry angiomas, you can get moles. Genetic moles can be abnormal, though. That's the thing. So it's just recommended to start doing skin checks.
Yeah, it's really important, I think, to make sure that you have somebody who is very experienced in doing skin checks and has their board certification in dermatology, or is a physician assistant who's been working in dermatology for a really long period of time. A lot of the things that we do in dermatology are visual. You know, It requires experience.
And it requires touching.
It requires touching people. If somebody's not touching your skin, I personally wear a glove in a lot of my examinations.
Right.
I know people who are like, let's say, phlebotomists, right? And they always like take the end off their of their glove to be able to like find a vein, to do it. And I've just worn gloves my whole entire life, so I can do surgery. I can feel things because tactile wise, for me, that works. For other people, it doesn't, because I know I have some dermatologists that are like, you have to touch people's skins with their hands to be able to make sure you feel like that. Yeah,
because a lot of things you feel before you see, especially in specific like skin of colors and stuff like that.
Yeah, so make sure that people are looking you from head to toe. Don't be shy. I have patients that do not want to undress, and I'm like doing above the waist skin checks. I'm going to tell you that you're going to be probably okay from the waist up, but I have no idea what's going below.
A lot of mine are more concerned that they didn't shave that day than having to get undressed. And I'm like, girl, it's okay. It's no shave November at this point, year round.
Right. I always tell them I only shave on Thursdays anyways. I mean, it's not a big deal. We see all sorts of things. And sometimes people are not shaving for a reason. And that's because they get some folliculitis from shaving. So it's a great way to diagnose something you might not know you could do something about.
I know people come in for skin checks and then they point out their itchy scalp, and then we move into that realm. So happy to help with all of it. It's kind of my jam. I enjoy doing what I do. I recommend seeing a dermatologist if you haven't been able to get things under control, like your melasma, at home with over-the-counter products, because we're able to confirm, diagnose, and get you a good, safe treatment for it.
All right. So what are your takeaways?
Not just sun. Heat can definitely make it worse, okay? It's going to be lifelong. It's all about the management. So consistency, patience, and again, skin protection. That means you're wearing sunscreen, or you're wearing clothes that have either UPF in them, SPF, anything like that. And that is not just women. Men, you can get it too.
All right. Well, we are going to dive even more in depth into different skin lesions and skin cancer in a separate episode. There's just a lot to get in one episode. So we wanted to make this a little segue into the maybe non-cancerous reasons why you might have differences in pigmentation in your skin. But we do a lot of skin cancer.
Yes.
Diagnosing skin cancer and removing skin cancer, doing further staging of skin cancer. So this is really important. So we were going to dedicate a whole episode on talking about melanoma and non-melanoma skin cancers and breaking that down for you in another episode. But if you have any questions regarding melasma, vitiligo, sunspots, folliculitis even,
reply below.
Yeah.
We'll get you an answer.
We'll get you an answer. All right. Well, I'm Dr. Rosie Roeder.
And I'm Andrea Spar, and thank you for listening to Rejuvaness Podcast.